My name is Dr. Henry Nkumbe. Keep watching Impact Voices. My name is Henry Nkumbe, Dr. Nkumbe. What I do for a living is helping people regain their sight. And this is Impact Voices. I think to impact people, to impact individuals, to impact the community, you don't have to, change the world or create something new. My story is a very good example. It was an encounter with an eye nurse in Nkumbe at the age of 13 that took me to where I am today. He was very gentle, he was very professional, he made me feel at ease, he made me feel comfortable, and he restored my sight. But he gave me 2 prescriptions. The first one he's aware of, it was a piece of paper for me to get a new pair of glasses, and the second one was his attitude towards me. And also the people I saw waiting, I realized that I wasn't the only one who had eye problems. And that's how I decided to become an ophthalmologist. It could start with one person, and with the ripple effect, it could affect an entire community, and why not the whole world. I am an ophthalmologist, an eye surgeon, and the CEO of a big eye hospital in Cameroon. My journey began as a 13-year-old, and that day in Nkumbe was a major turning point in my life, because my interaction with somebody made an impact on me. So I am based at the Maghrabi ICO Cameroon Eye Institute, Maghrabi International Council of Ophthalmology Eye Institute here in Yaoundé. It's a referral state-of-the-art hospital which has 3 main objectives. The first one is to provide quality care at par with what you can find anywhere else in the world, Europe, the Americas, and what have you. That's the first objective. The second one is to train the next generation of eye care specialists, ophthalmologists, eye nurses, eye hospital administrators, and public health researchers in eye care. And the third is to take our services to the communities, to the villages, to people who normally wouldn't have access to eye care. If I may add, based on data we have, less than 20% of Cameroonians who need eye care services have access to a qualified, well-trained eye care professional today. Well, 250,000 eye consultations, of which 25% are entirely or have been entirely free of cost to the patients through our outreach program. We go to villages, we go to small towns where people would otherwise not have access to eye care services. We have performed more than 12,000 eye operations, of which 9,000 are for cataract. Cataract is the first cause of reversible blindness in Cameroon. We have provided training to more than 200 eye care professionals from 11 African countries. Now, I just mentioned that we've performed 9,000 cataract operations. I wish to add that one of our first trainees, who came from Guinea, the Republic of Guinea, 2 years after his training, had performed more than 3,000 cataract operations alone. So that is a multiplier effect. We believe that we alone cannot reverse the sight of 10 million blind Africans. And so we've opened our doors to other Africans from 11 countries. The majority of our non-Cameroonian trainees come from the Republic of Burkina Faso. We have made Cameroon to become a medical tourism destination. We have a lot of patients coming from neighboring countries, chiefly Chad. There's hardly a week that we don't have a patient from Chad. We also have from the Central African Republic, from Gabon, from the Congos, the 2 Congos, and even from neighboring Nigeria. So that's what we've been doing. We have a lot of objectives, we have a lot of plans for the years ahead, and it might sound very, very ambitious, but our target for the next 5 years is to total 1 million eye consultations at the Maghrabi ICO Cameroon Eye Institute. The first thing is you must believe in what you want to do. There's a lot of need, there's a lot of things that can be done. But once you have identified something for which you have a passion, you should go for it. There will be obstacles on the way, but I like the book, The Obstacle is the Way. It explains everything. You just have to keep on going. And also, at times, it is very small things that count.